Hi, Stephanie. How's Terrell? How are you guys doing?
Good evening.
Amazing. Can you guys hear me properly? Sorry about that. Then we have our upcoming Maryland Regional uh, Cooperative and Solidarity convening, and that is taking place in Baltimore on November 21st, 2025. We're also opening up registration for that this week as well, and I'll make sure that we keep in if you're updated with our email list, you'll receive the link through that as well. And then I'll go ahead and introduce our wonderful moderator for today and then our speakers. Our moderator for today is Shelly Miller. She is the Director of New Ownership Opportunities and Outreach at ICA Group. We have Electra Shaletsky, Director of Shared Ownership at MCCD. We have Stephanie Sukasa, who is the Home Care Professional at ICA Group, and Terrell Cannon, who is a Director of Training at Home Care Associates. So I want to thank everyone for joining us today. And with that, I'll hand over the conversation to Shelly, our moderator for tonight.
Thank you, Mal, and hello, everyone. Thank you for joining us this evening. Just to do a little bit of housekeeping with you, what we're going to do is have each one of the panelists speak to you a bit about the work that they are doing in the Black home care industry, cooperative industry, and then we'll do a Q&A at the end. So if you are able, please to hold your questions to the end. We're going to be happy to deal with them, and we do hope that you will engage with them. So each of the panelists can tell you a little bit more about them. I know you've seen their bios already, so we won't lose a lot of time doing that. And so I'm just going to send it over to Terrell and have you start off, Terrell.
Yeah.
Thank you.
Hello, everyone. Thanks for being here. I'm happy to be here to share the home care co-op ecosystem with you because I've worked with Home Care Associates since 1993, inducted as a co-op in 95, and since then we have been elevating the voices of home care workers as well as providing a quality job for all. As myself, that started out as a care aide and am now the director of the training at the co-op that I work with. Like many of my colleagues, we are the owners, the board members, the ones that make the decisions of the company, and I'm so looking forward to engaging with you. And I will pass it over to Electra.
Thank you, Terrell. It's always so wonderful to see your face and to be in space with you. You just fill up my cup. Well, it's wonderful to see folks on the call this evening. We appreciate you making time for this important conversation. I'm Electra Stadletsky. I'm based in Minneapolis, Minnesota, and I work for an organization called the Minnesota Consortium of Community Developers, which are very big words to say that in my role as the Director of Shared Ownership, I help folks manifest their wildest dreams for how they want to own and control and have agency over where they live and labor. So I help folks like Terrell who have big ideas about how they want to do business differently, get their business done differently. So it's always a pleasure to talk to folks that are interested in this model's applications in the home care sector. We need many, many more folks to kind of join forces with us, and I'm excited to talk to you about that this evening. And I'll pass it to Stephanie.
Thank you, everyone. So my name is Stephanie Sukasaka. Let me rename, I just noticed, and add the little ka. And it's great to be here with you all. I've gotten the pleasure of working with Electra, Terrell, so this is really like a mini home care cooperative conference, which I would love to, I want to invite you all to, and I'll talk more about that. But I'm based out of Milwaukee, and I work with ICA Group. ICA Group is a national organization, and in our work, we support cooperative development, we support the conversions of traditional businesses into worker co-ops. Sometimes the owner of the business wants to convert it, sometimes the workers want to buy it. And in my work specifically in home care, we have been supporting home care co-ops for many, many years, starting with Cooperative Home Care Associates based out of New York City, who was founded in the 80s and is the largest home care co-op in the country with over 1,500 members. So, yeah, in home care, we focus on supporting the national sector. I'm going to go more deeply into all the work that we're doing. But if you want to know more information and connect to resources, our website, icagroup.org, is an amazing place to start digging. And I'll hand it back over to you, Shelley.
Yeah, Terrell, I think it would be great to like share with the audience because you were a worker owner in home care. Like, what made you first come into the field? And then from your perspective and that experience, how would you say uh, it is different from just conventional home care companies that deliver home care services?
Great question. That's where I like to start. So, I got into home care like many of us do as a family caregiver. I was that person my grandmother said to sit with her friends when a loved one passed in their families. So, I would have to, because then at that age, and I'm not, older, I'm young, but I've been raised with that tradition that when elders are in need of help, it's us, the children, that go and wait with them, as she, in her words. So it started there. And from there, in high school, I did a lot of things. I thought I was going to be a model. No. I thought I was going to be a lawyer. No. But I then went into the hospital and I was a candy striper. So I had my little striped uniform on and loved being able to work with the patients in the hospital. I had my little cart with the snacks and the magazines and got to really talk with people. When I saw that, I made them feel better. And I'm like, oh, I love this. It felt good to my heart. It wasn't really about the money. It made me feel good and enjoy to go to work because I knew I had something to look forward to. So I did make a mistake after I graduated high school and I decided, I'm going to wait before I, go to college and I'm just going to, go and work as an aide. And I went to a nursing home. When I got to the nursing home, I realized I was just a number. I really could not sit in the room with my residents for a long time. And I had about 10 residents in an 8-hour period. And it didn't feel like I was making the people happy or feel independent or feel, like people. And because I didn't, I'm like, okay, this is not working for me. So I decided to leave that job. And my friend told me to go on welfare because they give you free money. So I did. And I met my caseworker and she, I kept going for a check and kept trying to help people. And she was like, you cannot, this is not for you. She introduced me to Home Care Associates in 1993, which is a sister company of Cooperative Home Care Associates, which is the largest home care company in the nation. But we fall second to that as the largest home care associates co-op, thanks to our partners like ICA Group, Electra. So in doing that, when I got to home care, when I first walked in, they knew my name and they welcomed me and said, we were waiting for you to get here for a job interview. And then they had snacks and I felt like home. The interview was more like home. Even them interacting with each other in the office, it was very different. I got the job. And then when I got the job, I'm thinking, oh, I know what I'm doing. They said, oh, no, we're going to send you through training and you don't have to pay for it. I don't have to pay for it. So they sent me through training. I got my CNA license through training. My home care co-op supported me when I went back to college and I received my graduate degree in human services. So the co-op model is very different than traditional. You are supported not only in your professional best, but in your personal best. And then you're given the tools and resources to be able to do that and have self-sufficiency. I own my car. I'm in my house. I would not have had that just working for the dollar, getting overtime. I wouldn't have been able to make decisions. And the company that I work for that's going to support the work that I'm doing, that's wasn't heard of in a traditional agency. So coming into the co-op model, I don't see myself anywhere else because I don't fit. And I changed that. It's not that I don't fit. They don't fit for me. So in the, co-op ecosystem, each person is supported like an owner, and many owners of the company just worry about the bottom line, what the profit is, and there's no give back to the people who actually provided the real labor to the work. So I found that in this co-op ecosystem, whether it's in home care or it's in farming or different entities that co-ops and supermarkets and so forth, it supports the workers in the work that they like to do, which makes it easier for you to go to work every day and enjoy the work that you're doing.
Hey, thank you. And I'm so glad you said a few things because I realize that we're doing a thing that I hate, which is we are assuming
Mhm.
that everyone who has come to join us this evening are at the same level of information and knowledge that we're at about what is a co-op,
Mhm.
right? And I don't think we should do that. So, Electra, I'm going to lean on you. If we can just go through describing what is a co-op, what is this thing we're talking about that is called co-op?
Yeah,
Okay, and then I'd like you to tell us a little bit about maybe some work NCDD has done in developing home care costs. Maybe a little case study would be great to share.
yeah, happy to. And what a wonderful transition to hear how, Terrell found herself in a community that recognized who she was and how she could contribute, and how by saying yes to doing business differently, you transform the experience that somebody's having on the job, and therefore allow a channel for them to transform the way that someone who is receiving care feels about the care that they're getting. And that, like the power of that just cannot be understated. So for those of you who may not be familiar with how to define a cooperative, or you've come across definitions that feel really academic or still strange, and you're just like, how do I make sense of this? One way to think about it is that it is a vehicle, right? Or like a way of organizing that enables people to pool their brain power, their financial resources, their hopes and dreams together to do as a collective what may be more difficult to do alone, or something that they are responding to in community is erecting barriers, and they want to take a different approach to kind of break through some of the challenges, or to capture some of the opportunities that they see by coming together. So that's kind of like a more human way to describe how the model functions. And perhaps there are examples that you all have in your lives where you made a choice to work together with people, to problem solve together with people, to help folks that were in need of some support in ways that were not necessarily formal ways of saying that we're going to get together and we're going to have a campaign and we're going to do this thing, but rather through small conscious acts of offering your attention, your time, and resources that you have for a cause that resonates with you, or for an idea, or for a plan that resonates with you. Setting things in motion, with other folks that want to see similar things to you, because it's not always the same, through democratic practice, where you're exercising your ability to have your thoughts, opinions, perspectives, ideas recognized by other folks who also want those things recognized, and that you will work together to come up with the most resonant solution, or most exciting idea to test out and try. So that's one of the ways that I like to kind of introduce the model to folks. Well, I'm just so happy that folks are here. So we're gonna kind of dive in. I'm gonna tell you a little bit about MCCD and kind of how I came to this work and how this work is shaping up in the community I live in. So, um, when I think about this work, first and foremost, I kind of think about lineage, and Terrell talked about this link as well. Um, and our traditions and what's a part of the culture and the way in which we are often reared to respond to change, to aging, to folks who need us. And, Black women, Black caregivers more broadly have always been the backbone of how caring happens in this nation. From some of the darkest times in our history to sustaining entire industries today while being denied fair wages and ownership. Um, Care work has always been cultural work, survival work, certainly sacred work. And in Minnesota, a really exciting opportunity came up a few years ago. So formerly, I was doing something much, much different, and came to working in cooperative development and cooperative organizing really because it made sense to me. It made sense to me to work with people to self-actualize and to do things that they wanted to do in the manner in which they wanted to do them. And I was a part of too many environments, whether they were job environments that I had experienced myself, or institutional type environments, or a number of different types of ways that it showed up that reminded me that there wasn't only one way to do things, and that sometimes it's both about dreaming bigger but also remembering um, who we are as a people and what we've been able to accomplish and the ways in which that has never been fully appreciated, but doesn't mean that that work was not valuable then and cannot still be valuable today. And I moved to Minnesota a few years ago um, to really get more deeply involved with helping a community, particularly um, in an environment that was plagued by both racial wealth disparities, but also had some rich, fertile soil for organizing community. And that's kind of what brought me to Minnesota. And in that work, I came to meet all the wonderful folks at the ICA team because the organization that I work for, MCCD, was approached by someone who was aware that the Minnesota Department of Human Services was considering some intervention strategies for addressing some of the like critical and chronic issues that are occurring both on the workforce development side, with high turnover, and a number of different things that kind of plague the industry on the workforce side, but also like the care crisis, where there are too many elders and individuals with disabilities who are on wait lists, who are not able to live the dignified, self-determined lives that they want to live and stay in their homes and be a part of their communities. So they need a different solution. And in researching, the agency conducting research to try to figure out how it was that they wanted to handle that problem, they came across many of the publications that the ICA group had partnered with my former employer, the Cooperative Development Foundation, to publish, to help people make sense of how home care cooperatives could address chronically low wages, high turnover, a lack of stable career pathways and effective scheduling, to allow people to reap the benefits of their own labor. And someone in this massive state agency said, that sounds good. Let's give it a shot. So essentially, in 2022, they worked with the state legislature to pass legislation to use some of their American Rescue Plan or COVID relief funding to establish a series of different workforce development grant programs. And one of them said, we're going to give frontline workers, caregivers themselves, resources to build their own businesses or to organize to convert businesses where they're employed. And MCCD was asked to pilot and administer this program. And certainly what you're hearing, I think, in this conversation is that it is a rare occasion where successful projects happen without the help of others or without someone who's gone before you to say, we're going to hold you by the hand and take you along for the ride so that you gain the experience and the wisdom to apply to your own context. And that's what's happened for Minnesota. If not for, the cooperative where Terrell works and all of the fabulous work that's been happening at the ICA group for more than a decade in the home care space, MCCD would not have been able to run. We would have been crawling for a lot longer than we were. And I will tell you that we can get into this a little bit more, perhaps later on in the conversation, but the program, while it was well-resourced from the beginning, the state put more than $1.7 million into this program by awarding working capital grants of about $162,000 to up to 10 co-ops. There was a tremendous amount of interest. I think we had more than 124 applicants. Some were groups, some were not groups. We had a lot of conversations and did a lot of exploring and dreaming with folks that wanted to articulate what it was that they wanted to do with those resources. And ultimately, through a period of interviewing and getting to know these folks and matching them up against the eligibility criteria, there were 5 groups that were selected. 2 of those groups were in Greater Minnesota, and they were majority white groups. And then there were 3 groups that came out of the Twin Cities metro area, which spans about 7 counties. But all 3 of those groups were almost entirely Black. And it was just a phenomenal thing to see that all of these bold and brave and talented Black women, largely Black women, there were some gentlemen in the mix too, were coming together to say, we're going to give this a shot. And I had the good fortune and the pleasure of working with those folks for the last 2.5 years. And in that work, we ran up against a number of different challenges that tested their resolve, that demanded that they pivot, that asked them to hold one another with grace and understanding, and to stay committed to their North Star. And the program unfolded in ways that were surprising to all of us. And I'll give you an example to kind of crystallize it for you. Some of the difficulty that can happen when a lot of resources are made available is that the pathways through which you're able to access or exercise those things, like they didn't quite work out the way that we had hoped. Like, for example, in the direct care industry, you can hire someone and pay out of pocket for their care. You can use programs, state-based programs that are supported by federal resources to get public pay support for your care, whether that comes through the Veterans Administration or it comes through a Medicare or Medicaid waiver. It's not always easy to navigate those systems. And the very fine, let me see, there was 19 fabulous folks that stepped up in the metro to build these co-ops. They were met with quite a lot of challenge at the beginning, meaning that in Minnesota, you can do some services without a license, and there are other services for which you need to have a license. But what they didn't tell us at the start of this program, when these folks signed up to do this work, was that there was a 3-month backlog to get licensed that became a 5-month backlog, that became a 9-month backlog, that became an 18-month backlog, that is now firmly sitting at a 3-year backlog. So when I tell y'all that these folks were unmoved in their resolve, they said, you know what? This is our shot. and they stuck together and they have done the thing and they have built incredible businesses where they are helping elders and individuals with disabilities live the lives they want to live in their homes and in their communities and being able to enjoy the things that they love the most in ways that are suitable for how they are today. So it's really, really kind of cool. So we went from having effectively one home care cooperative in Minnesota to now there are six. And we went from that one home care cooperative serving one county, very rural in greater Minnesota, to now across the state, these five new home care cooperatives are serving 21 counties, more than 300 Minnesotans that need some support. And all of our young co-ops, our Black-led co-ops, are poised to be hiring this year. One of them has added a job, and they're very proud, and we are very proud of them. And another home care co-op is interviewing folks as we speak. And the third co-op is not quite there yet, but it's on the near-term horizon for the thing that's on their heart to do. So I'm happy to answer more questions about that. But I would love for my good friend Stephanie to tell you a lot about how Minnesota is a part of a huge, powerful network that she is at the center of.
So thank you so much for that, Electra. And Stephanie, just before we move into you, I think I want to maybe fill in a little bit. And I love the panorama that you kind of presented. But at the very end, there were some things that you said that I do want to highlight, which you said business, their businesses, and now they're hiring, and the issues that they ran into. And the reason why I want to stop with that, because when I do presentations on this, and in my job, I do not just home care, but cooperatives, I do stress the fact that worker cooperatives are businesses. So it's a model for running a business, and they are for-profit businesses. So the same kind of market studies and research that you need to do for businesses are things you need to do for your co-op when you're in specialized fields, especially one like home care that has so many elements to it. You do want to take that extra time. There are resources like Electra's organization, ICA, there are other organizations, Charles organizations that are out there that can help you. And, we hope that you will come to us. So I wanted to just interject that because, you set up this business and the model is different in that the workers, I like to call them owners. So
Mhm.
shift your mind from being workers, as Terrell said to you earlier about her experience, to being owners, which we're not really taught that in America, right? Most of us are taught to be employees, not really the owners of our business. And I wanted to stress that because we create these entities and we call them cooperatives instead of just regular corporations like, the rest of America. And instead of us getting a bunch of corporate shares, we get one membership share. And that entitles us to vote. That democracy that Electra mentioned, and with democracy, there's responsibilities. There's not just rights, there's responsibilities that
Mhm.
you're going to have in that co-op. So I'm saying all that to say we start at the firm level. And I say we have this idea of change, a theory of change, where we start by building firms of a certain type, which all of those beautiful um, kind of values that Electra was sharing with you, those are the values that we believe are just built in to the corporate model. And from those firms, we build out networks, which is what Stephanie's about, to share with you that ultimately expands into communities, which we ultimately want to be the entire community of America because we're way behind the rest of the world. So I just wanted to say that. And Stephanie, I'm going to turn it over to you so you can talk about the network.
Thank you. Yeah, I mean, I love I think it's so important. I love that we're having the perspective of the individual cooperative that's being offered by Terrell and Electra. You really get to show what a state-based solution is, language we've talked about, where you are advocating for the home care cooperative development within Minnesota. And so through our work at ICA Group, we have the over 40 years of experience within the home care cooperative world and industry. And from that experience, we have drawn out conclusions, listening to the sector, being a partner in the sector of what is the thing that is needed for home care cooperatives to continue to thrive and to continue to be competitive in the market. And as we were searching for what is that, how do we get there, we arrived at building a network and building a secondary cooperative. And I don't know if you guys have in the audience have heard of a secondary cooperative. A secondary cooperative is a solution that cooperatives in a specific sector may want to take. You may want to take this route. It's not the route that every industry needs to take. Home care did need to take that route because there were so many barriers and obstacles within the industry. And so the solution to getting over these barriers, and I'll talk more in detail about what these are. Electra, you've named a few. Terrell, you've named a few. You require individual agency or individual cooperatives to come together to build this secondary co-op. And the purpose of the secondary co-op is to support the individual cooperative members in their business growth and development. So that is what has become Elevate Cooperative, and I'm gonna share a few slides. Elevate Cooperative is the national network of home care cooperatives, and it has been developed in partnership with ICA Group, Cooperative Development Foundation, which Electra also mentioned, who has been a partner in this work for like a decade. They have been supporting financially. The development of Elevate Cooperative, but also the Home Care Cooperative Conference, which is an annual gathering of the home care cooperative sector, where we do business support, resource sharing. It's just a time to get together and build with each other. So that is what Elevate Cooperative is, a secondary cooperative, and it's owned, and it will be fully owned and managed and led by the home care cooperative sector. So all the individual home care cooperatives across the country. At this point, in the phase that we are at with Elevate Cooperative, it's being led by an advisory board, which is composed of home care associates, Terrell's home care cooperative, CHCA, Cooperative Home Care Associates in New York. We also have startup home care representation through Courage Home Care that's based out in California. And we have cooperative developer support through the NWCDC. So this is the Northwest Cooperative Development Center. There's so many acronyms in our worlds. That they have also been developing home care cooperatives. They are also a great resource out in the Northwest. And that's actually where we have a large concentration. We have 6 in Minnesota, but we also have 5 and almost 6, one in development out in Washington. So they have been a force in helping develop home care cooperatives as well. So this is the advisory board. And so as the advisory board, they help make decisions around, well, what are the membership benefits that we want to offer? And other things like governance design. How do we make sure that each member of this secondary co-op has the voice? What do they decide on? Like all these different details that are important to the building of Elevate. And so the benefits that Elevate Cooperative offer are speaking to pain points or challenges that exist within the home care sector. The first one that is a part of membership benefits is Elevate Community. And when you get these slides, you'll be able to link yourself to Elevate Community. Elevate Community is a digital platform to help home care cooperators connect with each other. Something that we heard time and time again is like, we love the conference. We love when we get together. We wish we could do this more often. We wish we could connect with each other. We wish we were updated on the news and like knew what's happening in other places and other co-ops. So through Elevate Community, when you log in and join, you get access to a directory of other home care cooperatives across the country. You're able to send a message directly to anyone in the directory. There's a forum there where you're able to ask any question from another administrator. So, you know, when you're starting up, you want to know, well, how do you handle payroll? Or what's the CRM that you use? What are you using to manage your clients and customers? All of these kind of operational questions you can ask on the forum, and you will get an experienced home care cooperative administrator help you get their input. We also have resources in the resource library on Elevate Community. And I'm going to talk more about those, but once you log in, you can check out materials from past conferences. You can check out materials from webinars, and also, let's see, we have our Launchbox documents there. So it's a resource library of everything home care co-op. Another membership benefit is Elevate Training. So another challenge that home care cooperatives have shared throughout the years is that it's hard to onboard new members and explain to them a cooperative. How does it work? It's also hard to explain how the business works. Oftentimes, when you have been a caregiver in the traditional home care space, you don't really have the experience of like looking at the finances of the business. You're not really, that door isn't open to you. And it is when you're a member of a co-op. So there was a gap in that type of cooperative education, but also financial type of education. Shelley was emphasizing it's a business, right? And so really helping new members understand the business part was named as something that is a need. And so right now we have 3 videos that are piloted. They're linked here. Check them out on YouTube. I think they will be a great space and place to just get started and learn more. And the future goal with Elevate Training is to do vocational training. You know, Terrell's an amazing trainer. So we're partnering with our resources, our community to build this out. And yeah, we're gonna expand into that and meet the need of training. Something that is true of home care is that there's no standard nationally for home care. Some states by states decide what the standard of a home care worker is. So we have states like Washington that have high standards, and that's great because we want people who are trained. It is very sacred, delicate work to care for our elders or care for our community with developmental disabilities. And then there are other states that have no training standard whatsoever. And so we want to make sure that we offer training nationally, that we start to set some standards as a sector, because the home care cooperative sector, when we go and talk about our values, part of the values is quality care for the community we're serving. So that's like in the works, but that's the goal. Our third membership benefit is business resources and supports. And so this looks like, maybe let me make this bigger. This looks like our coaching support. This also looks like offering access to insurance, business insurance, and a specific broker that works with Elevate to help get home care cooperatives a good price for workers' comp and business insurances that are necessary. And this is also a broker who is familiar with the home care cooperative sector. So like, it could be a really great partnership. And so that's the third service, because it is necessary to, have access to the business support, and like we've talked about them being a business, and how do you make sure that you're expanding? It can be challenging. The market changes. So how do we make sure we have tools for you as a home care cooperative to always access and be dynamic in your business? The fourth benefit is health, dental, and vision plans. And so a lot of home care co-ops have not been able to offer these benefits to their members. And so we have done a lot of research finding a plan that could work with everyone's needs. We work with immigrant-led co-ops. We work with big co-ops, smaller co-ops. So like what plan can we find that can help everyone meet the need of having some benefits and also stay competitive, because franchises or larger home care corporations oftentimes are offering some type of benefit. And so bringing that into our space and into the home care cooperative makes us be competitive and helps us not only meet the need, because like medical benefits, dental, vision, that's all so necessary for all of us. So we want to be able to offer that to the team of caregivers and administrative team. So that's the fourth membership benefit. And in this visual, you'll see, so this is representing Elevate Cooperative. The goal is to help elevate home care cooperatives in all aspects of the word. And these represent member home care co-ops. And so each member home care co-op is going to have access to these basic membership benefits. And then we additionally are going to have some add-on benefits, and these are optional. The two add-on benefits that we currently have are Elevate Digital, and so this is supporting the digital marketing needs of home care co-ops. We have learned that that's another challenge, having a good website that is SEO optimized, search engine optimized, and having content to bring the credibility of your website up so you show up in the first page of a Google search in your local area. That is the purpose and goal of Elevate Digital. And then the second add-on benefit we have is Elevate Hub, and this is something that we're still developing, but it's meant to be more of like it's meant to be back office support to really help the operations team of a home care co-op have additional support with managing the day-to-day, the systems. It's going to include access to QuickBooks account and offer, our team the access to your home care co-op to be able to analyze and come up with strategy and plans to help the co-op grow. So that's in a nutshell what is Elevate, and it's really in a simpler way, bringing the power of each individual home care co-op together to be competitive and continue to show the cooperative difference in home care. Because I love whenever I talk to our home care cooperators, they are running a business where they really truly are all caring about their clients in such a deep way. And so it's so important to elevate these types of businesses. We live in a world where there's not enough appreciation for our elders. There's not enough funding and support for the services that both our elders and people with developmental disabilities needs. And so I'm talking about right now, Elevate Cooperative is at the phase of let's get all the home care co-ops strong, so that in the next phase of Elevate Cooperative, our goal is to also have the network power to move forward advocacy and policy, because the system is not working. And ultimately, we need to change laws. We need to change how we prioritize where our federal funding is going so that we can have the money allocated in the right things like care. So that is the grand vision of Elevate Cooperative, is like, we're going to start by making all our co-ops strong, growing the sector. That brings me to the resources that we've created along with CDF and other partners to launch new home care co-ops. And the bigger goal here is the network is going to help us advocate and push for policy change that is absolutely necessary so that we can really start to change how home care works in this country, in the US. And ideally, like Shelley said, the world, you know? So I'll talk a little bit more about what we have for starting a home care co-op. I know a lot of y'all are interested or curious maybe, or maybe you know someone in your community that would love to get access to these resources, maybe other caregivers. So please share. But the first resource that I want to point you to are the Launchbox documents. So this links over, we have the documents in English and Spanish, and you go through everything you basically need to launch. There's a business model canvas, which is an activity to identify, what are the different elements of your business, value propositions. We have client care records, like super essential templates, a financial planning tool, marketing plan template, 3 ways to launch a home care co-op. So it's basically a startup toolkit. So that's one resource that you're going to be able to access through this link, the Launchbox documents. The second resource is the Home Care Cooperative Initiative. So this is the work that we talked about CDF being a part of. And so there's a lot of awesome resources here. Podcasts, webinars, resources. And then the last thing is I would love to invite y'all to the Home Care Cooperative Conference. If you're really curious and interested in learning more about the community, connecting with the community, this is a great time. It's going to be in October. And so, yeah. In this slide, I have our information. So this is going to be sent out. So you can email us all any of your questions. I'm going to stop sharing now and hand the mic over to Shelley again.
Okay, great. So we're about to start the Q&A, which I'll probably kick off with this one question I'm going to pose that I'd like each of you to answer. So a little more housekeeping. There's a Q&A box. So you can put your question in there, and I guess I'm really going to rely heavily on Amal, who I no longer see on the screen for some reason, but hope is around, who will be managing throwing those questions. And there's also a raise hand. So Amal, I don't know if you want both of those options, but we do hope that you will, send some questions to our panelists. And as I said, I'm going to start off with a question that I have. But I do also hope that you found that really kind of inspiring, because I think we all know, right? Like as essential as care industry is, both home care and child care is another one, right? So essential to what we all need, but so undervalued to what we're willing to invest in it or pay for it in this country, right? So what happens is that it's flooded with bad jobs. What Terrell was talking about, like that experience that she was having. Because, in a system that we have in America, right, the capitalist system we have is based on the theory of competition and scarcity, which unfortunately can lead to extractive practices. And what we want to do in the cooperative world, and I think in the Black community, we have a long history of this, right? Against lots of different odds, cooperation in abundance is the approach. So just want to throw that out there. We have a saying at ICA that we want to give our home care um, worker owners jobs worth owning, ultimately, right? So now I'm going to throw this question out, and I'm going to ask each of the panelists from their point of view. What's the most pressing challenges that's facing workers in the home care industry, and how you see worker cooperatives providing a solution to those challenges? So, Terrell, shall we start with you?
Yes. So
Okay.
one of the challenges that has stemmed from years before me is worker dignity, respect, and voice. Um, and and home care workers today, like I said before, I've witnessed that there was no room for me to, in the work that I'm doing, that I feel every day, touch every day, see every day, smell every day. I had no voice for change. I had no voice for advocacy for myself or my consumers, and I had no power. In the cooperative model, the solution is to provide the workers with the power to make the change. As we talked about, and many of you mentioned that the democracy of it all, for us, one of the things that work best is that our board members are majority workers. And I'm gonna quote you on that, Shelley, are majority owners. So those owners are at the table. They are, and like you mentioned, they may not know how to read finances. Well, that's a training that they get for free on how to understand finances, how to be a board member, how to run your business. And one of the fun things we do with that is we use a cake
Mhm.
and divide it up, and then we get to eat the cake as we're the owners. But in that, one of the challenges with that is that voice. Because if traditional home care agencies will listen to the workers, you would know what dollars you need to go out for. You would know what training is needed. You will have a higher, you will have a lower retention rate because people will stay. And that's what we see in our home care co-ops. Even through COVID, COVID has changed the way that we live, but in a worker co-op, we're still standing because it was the workers that decided on what was needed during that time. How are we going to do what we need to do for ourselves and our consumers during that time? And who's best to make those decisions but the workers? Um, One of the other most pressing challenges is access to funds. So most home care agencies don't have access to funds. Well, in our co-op world, we link with people like Electra, ICA Group, jobs worth owning, right? To be able to learn, not only just gain dollars, but learn how to use those dollars that's more beneficial to the workers who are making the decisions. So in a traditional home care agency, it behooves you to not adopt this model, because not only will this model make your bottom line very pretty, it will also give your workers the sustainability that they need to continue to do the work. And with that, we also include the consumers we care for, because the consumers are elated to know that I don't have a worker working for me. I have an owner working for me.
Mhm.
And they feel more committed not to the agency and home care social. I'm there for 31 years, right? I have colleagues that are still there for the same amount of years, 20 years, 25 years, 27 years, and those consumers are still there as well, because this model not only supports the work, but it also supports the quality of service that's received. And through our collective, we're able to build a system that I think in 10 years will become the world, because in order to get the political pull that we need, we all have to come together. The co-op world should be adopted across the board so that we all can come together to make the change that we need for ourselves and those that are in our communities.
Thank you very much, Terrell. Electra, I'd love to hear your point of view on this.
Man, I was deep listening to Terrell. Would you repeat the question, please?
You're on mute, Shelley.
Yeah, I think you're muted,
On
Shelley.
mute, Shelley.
Sorry. You know, I make this habit of mute myself because I like talk so much. But from your point of view, what are the most pressing challenges facing home care workers today and how home care worker cooperatives provide a solution? And I really should say, Black and brown uh,
Yeah,
home care cooperatives in particular.
yeah. Um, the first thing that comes to mind for me is that these are not easy jobs to have. This, depending on the nature of your role, this can be really back-breaking labor. It can be emotionally and psychologically difficult work to do. And because many folks that work in this field have been long employed by exploitative agencies, they may be folks of modest means, folks that don't have insurance of their own, or cars of their own, um, or stable, reliable childcare, which can affect your ability to get to work. So not only can it be really challenging um, to find folks that want to do this work and to introduce your business as a cooperator, as being different than what they've already experienced. Um, it's just that, it's not always an attractive field. And some of the folks that thrive in this field are because they themselves have a calling on their hearts to do this work. And they have found a home to do that work that values them. And maybe the trade-off is that you're treated well, but your earnings could be better. Maybe it's that your work is steady and your schedule is okay, and you have some benefits rather than none at all. But hiring and recruitment and retention can be tough in the field broadly. And I would say that where home care cooperatives have much higher, and thank you, the ICA group, for doing our benchmarking survey so that we know that this is true, is that Black and brown caregivers that work for home care cooperatives stay there much longer than that they do in other types of agencies. And there's a number of reasons for that, but you heard them from Terrell. When you're an owner or you have a pathway to ownership, and because cooperatives prioritize reinvesting surplus earnings back into their workforce and distributing profit sharing, they tend to be able to keep people comfortable and keep people in a better posture. But I would say that one of the other challenges is that, the care crisis doesn't stop at our elders and our community members with disabilities, is that there is a kind of simultaneous childcare crisis. And ICA Group works closely in that field very well too. And one of our development center colleagues that Stephanie mentioned, the Northwest Cooperative Development Center, was a development partner for a home care cooperative in Washington State that has been looking at ideas for bringing together elders and young people through the cooperative model, at helping them link together. And there are some exciting experiments that are happening in that space around the country at different stages of, readiness or ability to talk about it. But I would say that is a child, or that it is a challenge for the field, and it is a challenge that home care cooperatives are starting to step up to meet, because they're like, we understand, right? If, Tamika and Leslie can't come to work because they don't have a babysitter, and that happens over and over and over again, is that a failure for Tamika and Leslie? Or is that a failure because childcare is unaffordable? It's out of reach. Those workers themselves providing that care deserve a living wage, deserve to have the stability that we enjoy. And maybe if we link arms and help this model proliferate, we can do better by our entire communities by making sure that the continuum of care can be less disrupted. So I would say that one of the things that is beautiful about cooperation is that beautiful solutions emerge. And because the model itself is iterative and fosters innovation and people, bringing their great ideas to life, it means that your cooperative doesn't have to look one way or do one thing. In your exploration, you may find that there are some limitations. We ran into that a little bit, where I'll just tell you quickly. One of our cooperatives was exploring, actually two of them, were exploring transportation services. And because elders and individuals with disabilities or care needs, they got to go places. And sometimes their service doesn't include that as a part of the service. But what they found, and we've been navigating this and working with the insurance company that Stephanie named earlier, is that these co-ops couldn't get insured to provide the typical services that they were providing under the kind of home care, direct care, home and community-based services umbrella, and transportation, because it was considered a higher liability. But I'll give you the example of how co-ops are going to be like, well, we're not going to not do transportation. There is a need for it. Our clients deserve to have safe, flexible rides where they got to go. So what we helped some of these folks do instead was, okay, if an insurance company wants to see some separation between your lines of business and you can't operate them under your existing co-op business umbrella, we're going to help you spin off a subsidiary. And your co-op will own an LLC that is still owned, controlled, and governed by the cooperative members, but it will enable you to do the business that you wanted to do through a legal framework that manages those risks differently, helps you track the finances of that line of business so that you can do what you want to do and be able to refer back to it and see if that makes sense for your business to continue pursuing that.
Okay, well, thank you for that extra line. I just want to ask you, Stephanie, to address the question, and then we do have some audience questions that I want us to get to.
Yeah, I mean, I want to build on like Terrell and Electra, what you're all saying, like you're all naming challenges. And so just zooming out to a national lens, I think that, the home care cooperative model is such a powerful model. And in the 90s, federal policy changes around Medicaid funding really hurt the ability of home care cooperatives to serve in the public payer space. And I think that when thinking about Black and Brown cooperatives, like a lot of the times when we're talking to new cooperators who want to start a co-op and they're in Black or Brown communities, they want to serve the people in their community who do get public payer support, Medicaid funded support. And when we are, consulting them, we explain like to break into the home care market, there's different states where it's a different process, but in general, you will start in the private pay market because it has become so difficult to be able, you need to have very sophisticated systems to bill into Medicaid. And so you need to be at a certain scale to be able to bill Medicaid and accept clients within the Medicaid space. So there's a big barrier there because we don't have Medicaid that is funded adequately. We've seen in the since the 90s, the growth of the managed care organization where insurance companies are managing Medicaid funds, paying very little. So a lot of home care agencies, private and cooperative, have closed because the Medicaid service rate that they're being reimbursed isn't enough. So I think on a national lens, like speaking about, going back to the conversation about what are we funding as a country, having a Medicaid program that is again funded and not organized or managed by these insurance companies, but we implementing a system in which the funds are being able to be distributed to these home care cooperatives that really want to do the work, want to do great quality work, but are being, there's a stop there because they're not able to provide services to people who get those benefits. So yeah, I would say that that is like something that we want to change, and it does come with us collectively as a sector moving ourselves, activating ourselves to advocate for this larger change on a national scale.
Okay,
And yeah,
I feel like we maybe have thrown it's a little bit, I feel like things might have gotten a little bit confused there because I think I'm not sure it was so clear as to what you saw as the challenge facing the home care workers and how the co-ops can provide a solution. So I just want to drill down a little bit
yeah,
on that. So, because I do have, some questions too. I'm sure people
yeah.
may have about
I
the
think,
financing, but what you're saying,
yeah.
if you can tie it to,
The challenge for home care cooperative workers is that for newer home care co-ops, they're only serving private pay clients, and a lot of times they want to serve those public payer clients that are Medicaid funded. And so the solution that home care cooperatives can provide to that challenge is advocating for changing policy on a national scale so that Medicaid is funded differently. And I think there's an opportunity there to also partner with the home care cooperative sector. Some agencies in the traditional sector also see that as an issue because that is one of the reasons why there are both home care cooperatives and home care agencies that are closing. So I hope that makes it clearer.
yeah, yeah. So, Amal, do you want to?
Yeah, we have a few questions in the Q&A. I think one of the questions was whether this is available in PG County, Maryland. Like, I'm assuming they're talking about home care cooperatives.
Actually, I think, hmm,
I wonder what is available, if they could give us a little more information. I know that there aren't any home care cooperatives in Maryland at the moment. There is through DC Care Works, and I'm happy to connect you if you shoot me an email. The goal of developing a home care co-op in a DC metro area, and maybe that would be helpful to connect you, the person who asked the question on does this or is this in Maryland?
and just for clarity, just to ask the person, is that what you mean?
Yeah,
By the phrase, you want to know whether or not there are home care cooperatives in Maryland. That's how we're understanding the question.
yeah. I think if you could add that to the chat. And then until then, there was another question. And it was, I'm curious about memory care in particular and how if family members can be trained to do this work for their own family member, possibly a couple at a time while still maintaining their cost of living and the mental health and emotional challenges associated with dementia, Alzheimer's, basically that the home health care worker needs at their own health dental insurance through not being able to work full time in another position. And they're asking, is there any guidance on this situation? And she noted that I recently added a community health worker introduction to the Alzheimer's Association, but I'm looking more at quality home health care not being affordable to many Black families who are not very low income. I know that's a little bit of a longer question, so
I can answer for the training pieces of it. So in our cooperative, our workers found that because our training was nationally recognized that we should separate it as a nonprofit so that we can be able to train the community. The workers decided to do that and we did it. So in our community in Philadelphia, we are the training institute that goes out into the community and provide that free training for family members such as dementia, Alzheimer's, also hospice care, as well as person with disabilities and intellectual services on how to properly understand not only the illness or disability, but how to also include that self-care for yourself and to have your mental health checked as well while doing the work. Um, we also provide those respite services for family caregivers as well, so that they can be able to take that break and attend those trainings that they don't have to pay for. And that way it's not coming out of their pockets or anything like that. Now, if they choose to want to work after that training, they'll get the full training with us, and we'll hire them as a family caregiver to take care of their loved one, where they're offered those benefits. And our benefits not only include health, dental, life insurance, dismemberment, but it also offers your birthday off. It also offers a discounted transportation card, so that you're able to get around. And we also offer PTO. So as our and we're able to do all of that by working together with different groups. Again, like I mentioned with Electra, Stephanie, the U.S. Federation of Worker Co-ops, and others to be able to put those things in place for our owners.
absolutely. Thank you, Terrell. And then also they added also wondering if there is any interfacing with the National Domestic Workers Alliance as far as legal and organizing advocacy and coalition building.
So I'm sorry, but I am a part of what's called a Healing Home Care Initiative. So the Healing Home Care Initiative is founded through the Ripple Foundation and the U.S. Federation of Worker Co-ops as well. And we're convening with home care workers, consumers, nurses, doctors. We're doing that, bringing everyone to the table for a call to action so that workers are heard. We could put what's needed on the table, and all of those entities that are there play a part in what that solution is. So we are convening all of those folks through the Healing Home Care Initiative that convenes, and I can share that information with you as well through the chat. And you're welcome to join and be a part of the conversation, become stakeholders. So, and it's a 3-year project. We're in our second year, so that we can continue to change the narrative of the home and healthcare system, and as well as push those other agencies that are not adopting that co-op model to be able to adopt that, to again support not only the workers but provide that quality of service to their caregivers.
Thank you, Terrell. And then I think Stephanie, you wanted to add something?
Just on the National Domestic Workers Alliance, we are connected to NDWA. We've attended their summit, and they're like aware of the home care cooperative work. There's not any like specific campaign that we're working on together, but definitely connected and in solidarity with each other. So when we talk about, policy and advocacy work in the future, they are one of the strong partners on the field doing a lot of the organizing work that we will partner and lean on for that.
I would like to add to that, along with the National Domestic Workers Alliance, is that we advocated for co-ops in 2025 in Philadelphia. And as a result of that, we were deemed and have citations for um, 2025 being the year of the co-ops from the advocacy work that we all did together with the National Domestic Workers Alliance. So we're very, we're like one big co-op family. So we are always convening with each other, building off each other, connecting with each other, and of course, advocating with each other.
Wonderful. I want to throw another question out again to the group. And Electra, maybe I'd like to start with you because I feel like it was touched on. And I do think it's really important to know this. Someone just asked, like, if there is none in Maryland, maybe we can get one started in Maryland. But here's a question that goes to that. How difficult or easy is it for a home care co-op to get financing, whether to start up or to stabilize or to expand? And then how hard or easy is it for a home care co-op to earn enough as an ongoing business to pay worker owners well, right? We want it to be a job worth owning. So I'm starting with you, Electra, because of some of the things that you shared about
Oh
the co-op
yeah.
you
Well,
guys
I
have.
love the question. Thank you for asking it. Um, so I would say that it can be tricky to untangle some of those questions, but not impossible. And there are folks that are available to help. So I'll say two things. Um, I am both a cooperative organizer and developer, and also a co-op loan officer. So what and that the lending piece wasn't necessarily something that my organization was always able to do. And I'll explain a little bit about why. So MCCD has been around for 35 years. Since 2011, MCCD has been a community lender, meaning that we work with small businesses, particularly micro businesses that are too small to have any employees, to larger businesses that do have employees. But what is typical in commercial lending for small businesses is that those lenders will require the people who are the borrowers to do a personal credit check and to personally guarantee the loan. And what that means is that in the event of a default or that somebody is unable to pay their loan, their personal assets are used as a secondary source of repayment. So, in a business model where folks come together to share the risks, share the rewards, and do it together because they are standing in solidarity with one another behind this business idea, and they are often equal investors in the business at a baseline. Some folks may contribute more over time. But what that means is that requiring a personal credit check or a personal guarantee on a small business loan is in conflict with the nature of the business model. So, because of that, there are a lot of lenders that don't understand co-ops. They maybe never heard of them. They maybe have never experienced one of them. And they certainly don't know a whole lot about how they work together um, in order to kind of make their business work. So there aren't a ton of lenders that understand cooperatives, much less lend to them. But I am happy to share with everybody is that number is growing, and it's growing based on demand. So for folks in communities that don't necessarily know if there's a co-op lender nearby, there are some that provide small business cooperative loans at a national level. That the one of the oldest among them is the Cooperative Fund of the Northeast. So they kind of work in and around ICA's territory on the East Coast. And then there's the Local Enterprise Assistance Fund, or LEAF. There is Shared Capital Cooperative that is also a national lender. And across the country, there are emerging loan funds that are cropping up within a variety of different contexts, often, again, responding to need and demand. So similarly, because the ICA group has been involved in cooperative development as the oldest serving organization in the field, they spun up a loan fund that you've heard mentioned in this call, the Fund for Jobs Worth Owning. So they also lend nationwide. And I see somebody mention the Seed Commons. So Seed Commons is also another cooperative lender, and they have projects all across the country. So there may actually be one in your community. So if you visit the Seed Commons website, you'll see that there's a map that's available. But nearly all of the funds I just mentioned, or lenders that I mentioned, lend outside of their territory. And then MCCD, we actually worked through our advocacy and policy capacity to stand up a loan fund that is actually like seeded. The capital comes from the state of Minnesota. Because we said, state of Minnesota, y'all are making all these investments in small businesses. That's fantastic. We want you to keep doing that. However, you can't just add co-ops to the way that you're doing it now because that underwriting criteria doesn't work. Work with us and we will show you that co-ops are no more risky. They don't default any more than other types of businesses. And that you can take a different approach to underwriting them based on the strengths and the profile that those businesses have. So when it comes to how hard is it, sometimes it can be a journey to get everything together that you would need in order to submit a loan application. And rarely is loan capital the only types of capital that come into a deal to help support a cooperative. Because the first thing that says, I want to become a member of a co-op is you yourself, caregiver, putting money into as your member buy-in. So there is what is called member equity that helps support the start of a co-op. Some folks might be able to raise capital from other types of sources. Sometimes that's fundraising, sometimes that's donations. On rarer occasions, you might be able to find a small business grant. You might actually be able to advocate with local government to set up a pool for which you can, access some resources. So there are some pathways, but I would say that, if you're looking for financing, you're going to need to understand how feasible your business idea is, and working with a partner like the ICA group or an MCCD or another small business or cooperative development organization can really help you flesh out what it is that you want to do and get you ready to test some of those assumptions so that you can get to a place where you have some information that will help you put together a business plan, that will help you put together your capitalization plan, your financing strategy, and your projections about how you think the business is going to make money and perform. Because all of those things are intimately connected to how it is that you'll be able to raise enough money to support your business. And then what I think the last part of your question, Shelley, was about, how hard is it for co-ops to make enough money to be self-sustaining? And I would say that depends on the group. If your group is passionate, your group is motivated, your group is willing to develop conflict resolution and democracy skills and decision-making skills, and you're friendly, and you are willing to tap into the network of amazing businesses like Terrell's that are succeeding and are growing and are adding jobs and have certainly met tough times and hard questions and shifts in the wind that affected their businesses, as all small businesses experience. But I would say that we have seen some businesses struggle more than others. And oftentimes it is not about a lack of clients, but sometimes it's about they may have leapt before they looked. And there were some key questions that they hadn't thoughtfully considered or planned for or pivoted around. Mm-hmm. And that's just kind of par for the course, right? Like nobody is born an expert on how to be an owner.
That's interesting. You said it's not a lack of clients, right?
Yeah,
Because
I mean,
usually
exactly,
like having a paying client is the number one thing that might make a business
Yeah.
successful or unsuccessful, but saying having clients and still these challenges with being able to success is paying them well, right?
Yeah.
So
Yeah. And
that's really interesting.
mhm.
And Stephanie, love you to jump in here because I know that you do a lot of work, directly with home care co-ops and their kind of business development and planning, especially around that second question. What are the things? And I guess to some degree, a lot of what um, you talked about before in terms of level up, I'm sorry, elevate, is addressing those. But anyway, if you could speak to it, because I saw you dropped a lot of stuff in the in the chat
I
too.
was just answering in the chat. Could you, I missed a little bit of the question. Do you mind
Oh
repeating it,
yeah,
please?
it was the second part of the question. So the first part was how hard or easy was it for co-ops to basically get financing, and you could address that too. But the second part was, and how hard or easy for them to basically earn enough money to pay the worker owners well. So those who choose to be home care co-op owners benefit.
Well, I
Thank
think
you.
I mean, I think you answered that the first question, Electra, like on point. It depends on the group in terms of like the success. Um, how long does it take a co-op to pay their membership well? It definitely is dependent on the market conditions. But when we start with a startup home care co-op, we start from we're paying them well. This is the service rate, like the balance between the revenue that's coming into the business and the wages that they're paying their membership from the beginning is ensuring the best possible rate. And I think with a startup home care co-op, some hit the ground running and just have the market conditions or maybe people on the team with the experience that they from month one are starting to generate the revenue to really be able to be supporting their teams. And other co-ops, it may take up to a year and a half to get that momentum where they're stable and starting to get to the position of hiring and growing their membership, growing their team. So it is something that varies. And then there are other home care co-ops that kind of start up strong and then slow down a little bit and come back up. Like we've seen it all in a way. And I feel like our benchmarking reports is a really great resource. If you're looking at how the home care cooperative sector is doing compared to the home care traditional sector, our last report, I think on average, home care co-ops are paying more than $1 and maybe 30 cents than the traditional sector. And it is, a benchmark across the nation. So there's some variance there. But year to year, since we started doing our benchmarking reports, and I think the first one started in 2018 or 2019, the home care cooperative sector has paid better their members and their caregivers than the traditional home care world.
Well, I know just in general in the social justice world, there's a movement for folks to be paid a living wage, right?
Yes.
But we know from experience, and probably Terrell knows better than all of us, that the home care industry, the traditional industry, is certainly not known for
Yeah.
that, right? So just wondering, is there that commitment within the home care co-op world when, as you said, when you're setting them up in the first place, that it is set up to pay a living wage at least?
Yeah, there's definitely that. And when we do, like when we're starting at like step zero with a market study, and there's a guide on a market study in the lunchbox if you're curious about how to understand that. We look at, what are people getting paid in the industry, and also what is a living wage in the area that you are in. And there's, of course, a balancing act of finding like, okay, how was this business feasible? And also paying their membership well, but it's always something that is kind of at the forefront of the planning. And it's a basic foundation. Like the value is embedded in how that decision is made. Yeah, in the beginning.
Okay, thank you. I just want to make sure to get this question out, and then we can kind of have a bit of a free for all, if we like, and maybe it's both of these questions that I'd really like to get out. One is how can we better integrate home care co-ops into the broader healthcare ecosystem, like hospitals, primary care, rehab, all of that, which may also be able to help with some of the financing issues and earnings issues that we've been discussing. So would like that addressed. And then finally, what does the ideal home care system look like in 10 years? And where do you see home care co-ops in that picture? And I think Terrell touched on that a bit earlier. So, in these last minutes, would love to get those two addressed. So maybe Terrell, you could talk about how you think we can better integrate home care co-ops into the broader healthcare ecosystem. And then we can also either you, Stephanie, or you, Electra, on where you see it in 10 years. Because I do think Terrell already kind of spoke to that part a little bit.
I did a little bit
Mhm.
by by utilizing um, partnerships like the Healing Home Care Initiative, like the Paraprofessional Training Institute, like ICA, like MCCD. You you want to, if we're able to bring in and advocate this model out to all of those entities and bring us all together, in 10 years, there will be way more home care worker co-ops that can begin shaping the ecosystem into a, I would like to say a mandate, so to speak, that when any business come up, this is the model that you're to use. I mean, if it's possible, because it only brings back, not only it puts the governance into the hands of the workers, and it provides self that sustainability for yourself and the consumers that you're providing the service for. They become more independent. And in that benchmarking study, it also mentions that, the consumers we serve don't go back to the hospital a lot. They
Hmm.
stay home, from worker co-op care to traditional care. So I see that integration into as a must. And thinking that if we can continue to have convenience like this, because this is what co-ops do. What we're doing right here now is introducing that model, giving you the tools and resources you need and the support you need to help make that transition. Yeah, there's bumps of, as we say at Home Care Associates, up the ships is going through the waves. They could be 100 foot, but we're still here. Move the hall, right? So in doing that collectively, all of us together, as we continue to have these convenings, to meet with other co-ops, to share, our experiences and tools and things like that, this can be integrated. I would like to say with ease, because, the obstacles are just, those are just stepping stones for me. I look at obstacles as stepping stones. So those are stepping stones that'll get us up to the next level. So if we do all of this collectively, we'll have a lot of stepping stones going forward.
All right. Stephanie, what about you?
Yes. I love when you're sharing our dreams. And yeah, at ICA, like our dream, our vision is in 10 years to have 50 home care cooperatives across the nation. And we're doing it, like the great work of MCCD through Electra, like they've incubated a cohort of home care cooperatives. In California, we have three new home care cooperatives, and the Vivid Life home care model, I didn't talk too much about that. It's another state-based home care cooperative development initiative. and they will be growing and replicating the model within the state of California. They've been doing well, and I'm also excited that we are finding funding for this. Like, I think Minnesota is an amazing state. Like, the leadership there has given money, and I know that that's come through advocacy and organizing. Like, that is how things happen. And it's been really powerful to be able to point to this state as like, hey, this is a model, it works, and you can fund this. And we are in the moment in which our elders need the support and care. So in 10 years, our dream is that the conversation will be around that, and that we will see more other states also investing into programs that will further support home care cooperative development. And all the organizations that were named here, all the team, the panelists here will be ready to continue to support. And part of the goal with the Launchbox document is we want this information far and wide. My personal dream is that people know what this is. People know what cooperatives are. It's not something that's like, oh, what is that? But it's common knowledge because we've taken up space in the digital world to talk about it, and present it. So I'll leave it at that. I'll pass it over to you, Electra. But it's very exciting, I think, the next decade and future.
Yeah, absolutely. I couldn't agree more. Um, I would say that there's an interesting opportunity, particularly for people of color that are living in rural communities. Is that, the loss of uh, kind of health infrastructure increasingly in rural communities, um, is really sad and devastating, and is changing people's lives tremendously. But we also know that as immigrant communities are moving into rural parts of states, that there are and increasingly more and more, Black and brown communities are moving into other parts of the state, is that cooperatives present an opportunity to fill a gap in the healthcare system, but also there is a there's a challenge to be confronted around who's getting care, who's giving care, and in some ways there can be tensions to reconcile, particularly in rural communities. In Minnesota, where I live, increasingly we are seeing East and West African immigrant communities that are moving into the central part of the state. Now, folks, Minnesota is a very white state when you get outside of the metro. Like, very white. However, when you're in central Minnesota and you're starting to see the ways in which that the communities are changing, some of the cooperatives that we worked with that are serving central Minnesota in particular, they're meeting different challenges, but they're also trying to turn those tough things into those stepping stones so they can pave a new meaning for the care that's available there. Where one co-op was struggling to hire folks, and ended up hiring a handful of Somali caregivers that wore hijab, and you're going into a home of somebody who may be struggling with dementia or some other types of cognitive differences that make them more sensitive to change, to smell, to accents, and feeling disoriented by people that have a different way of being than they do. And this co-op was finding that they were having a hard time keeping this caregiver with clients because of racism, right? Because also of just the differences that those clients were not prepared.
Xenophobia.
Yeah, were not prepared to hold, right? Or did not want to hold. And they reached out to us and they were like, what can we do? What can we do? And I said, what do you want to do? What have you been thinking about? When this caregiver came to you and told you this, what was on your mind and your heart? And anyway, to make a long story short, what we said was your primary responsibility is to keep that caregiver safe. So talk to them
Okay.
and
I
make
saw a
make your plan.
question,
Yeah.
Amal. It was here and then I don't know, it popped out.
I answered them via chat. The
Oh,
question is, at which step in formation of a home healthcare cooperative would you hire an attorney and or accountant, insurance and other professional services? How often are they needed and how much would you budget for outside professional services? I didn't talk about the budget. I think it really depends on what the kind of costs are in your own state and where you are, your own county, your own city. So that would take a little bit of research. But overall, I just shared that you are going to spend time at the beginning developing a business plan, but also a governance plan, working with the founding members to do the research and plan before you launch, and that these professional services are something you engage with right when you are about to get ready to launch, and you have all your ducks in a row, so to speak, in terms of how you're going to operate. What is your service rate going to be? How does your governance work? Membership meetings, your cooperative structure. And feel free to email. I know you can email me, you can email Electra. For any other resources that we may have in terms of professionals that we would love to refer you to. So that's what happened.
Thank you. Because sometimes there are folks in an audience that are a little shy about phrasing a question, or maybe they don't think of a question, but somebody else thinks of a question that, oh, that's some information that they would like to have too. So that's why I wanted to make sure that we shared the question and the answer with
Okay.
everyone. And then I'm going to try to
I have
kind
a
of put this in a question form.
sorry.
I think what's being asked is maybe who can they connect with for next steps. And what they've written here is I've designed some workflows and an organization for caregiving co-op. Got as far as selecting a co-lead representative of the typical workforce. Had to learn a ton about pain points in the workforce around turnover and mental health. So it sounds like they did great research, which they should. And then it says, happy to discuss more about cooperatively minded back in development in Maryland specifically.
Yeah, I think
So
that
that's why I said I'm going to read that as maybe this is somebody who might like to know how to kind of keep things moving forward and maybe getting something developed in Maryland.
yeah, I
So I
think
don't know
they might
who
have
should
been.
they reach out to on this panel for that, or can you direct them to someone?
Yeah, and then also I think maybe they had raised their hand if I'm not wrong. If you want to raise your hand and then we can, if you want to add something before we.
I was, for that question, I would say since there isn't one, connect with the group that's here to create it.
Yeah, and it looks like Terrell is saying that's a good person to connect with. I know ICA can probably connect you with,
Mm.
others if they can't do it. So there are folks, I mean, we're in the Northeast, so definitely, you know, like we said, each state might have some laws that are particular to the state, but in terms of setting up the business plan and the model and the governance structure, that's something that can be across the board. So I think all
Yeah.
of these panelists are people maybe you can reach out to.
Yeah, reach out to us, and I'll just say, like, there's many resources to reach out to, and the Launchbox is a great place to just start exploring. There may be answers to your questions within those documents. I do think that connecting as humans and talking to each other is super important. So also connect with us, and we're happy to connect you with other folks that are helpful, because it really takes a community, and we have an amazing team across the country that can support. I do also want to uplift NWCDC, Northwest Cooperative Development Center. Like, they have been doing home care also for a long time and can support if you're thinking about the West Coast. But yeah, reach out to us. Our emails are in the chat, and we'll connect you to whoever is someone you need to talk to.
And I know you said the home care come in October. Is
It's
that
on October. Yes, it's
and
changed.
where is that going to be? What?
It's going to be in Washington State.
Oh, so
Uh,
that is different because it
it's
was on the north in the Washington
it
D.C.
has
area before, right?
It used to be in DC. It has been in DC for a long time. This year, the 10th Home Care Cooperative Conference, which is this year's, is going to be in Washington. So yeah, I've added a few of everyone to the newsletter that wanted to be added. If you're interested, send me an email or share your email in the chat, and I'm happy to add you to our newsletter, and you can stay up to date.
And something that I'd like to do here, so Ron, even though I'm already on, I'm going to give a little plug, right? Because NDCC does run an academy, a cooperative academy. And the thing, we're talking specifically about home care. You might have gotten, from me, I'm more of the generalist, right? Because the general rules that apply and knowledge that you should know is something that you would get from the academy. And then you're going to apply it to the special area, the specific industry considerations for home care, if that's the kind of call that you want to develop. So I want to say that that is also a resource. Of course, I mean, I don't know when the next offerings are. That's something that maybe Amal can speak to,
Yeah,
Well, thank you,
but
Shelley.
those can be helpful as well.
yeah.
Going to
Go ahead.
Well,
the
thank you,
summit, if you can
Shelley.
make it to Washington State, and academies. Amal?
Well, thank you.
Yeah.
Thank you, Shelley, for the
Sure.
plug.
Okay. Well, Ron can add to that. We're currently having our fall session. We just started. And yeah, like Shelly said, it's a great resource to learn more about cooperatives. We're gonna have our spring session as well. I'll share the link in the chat. And we have a page on our website, and you can learn more about the Co-op Academy. So yeah, thank you so much, Shelly. And Ron, if you want to add anything else.
Oh, job. Shelley did, pardon me. Shelley did a wonderful job of sharing.
Yeah.
Thank you, Shelley. Thank you.
Absolutely.
hmm Yeah. Well, I do want to just say that I said it early in the chat, but I really appreciate all that you bring to the space of caring, particularly caring for those people who are injured, those people who are having health challenges, those people who are aging up and aging out, because it's so important. You know, the one of someone told me that the earmarks of a great people and a great nation is how it treats its elderly. And so I'm mindful of that, and I know that you are too. So again, I thank all of you for your intellect, your wisdom, and your commitment. So thank you.
Absolutely. Thank you so much. If anyone wants to have any closing remarks, thank you so much, Shelley, for leading tonight's wonderful conversation. It was wonderful to hear from everyone. I see one hand raised, so I think we can take one more small question.
Sure.
I mean, Michael, sorry, I unmuted you.
His thing is still showing it's on mute.
Yeah.
Maybe Michael, you can do it yourself to take your mute off. Okay,
Yeah.
here
No,
you go.
actually just trying to throw up some props and say thank you for all your inspiring words and thoughts. That's all.
Thank you so much, Michael. Yeah, absolutely. Thank you so much. Everyone in the audience, I think, has been echoing that as well. thank you so much for taking the time out today. Stephanie, Electra, Terrell, Shelly, thank you so much for the entire work from the planning of this conversation to today. Everything, it's been wonderful working with each and every one of you. Yeah, absolutely. Paka loves Terrell.
Thank you, Pekka.
Thank you, Packer.
And
I
and
love
and
Packer.
and I
I
want to
would
say
like
my
to.
vision for in 10 years is that you're going to be extremely successful because that's about when I figure I'm going to be needing you guys, and I want things to be very different from how they are right now.
I was just gonna say that to take the takeaway is that, for those of us that are not co-op driven yet, to become co-op so you can shape the care that you want when you age. Because that's what we're shaping the way for those behind us, so that we're helping the ones in front of us, so that when now we're in front of them, we know what we're gonna expect because we've paved the way for them to do it.
Mm.
Thank you all.
Mm.
And I hope you all and the audience that is still here with us have a wonderful evening. And we
Okay.
get 4 minutes of time back.
4 minutes of time.
Thank you.
Good night, guys.
We done?
Thank you for being with us.
Thank you so much,
Yes.
everyone. Thank you. Have a great night.
Thank you, everyone.
Bye. Thank you.
Yeah.